An emergency room doctor in Adams County is sounding the alarm about the rise in coronavirus cases. He's hoping to inspire others to get the COVID vaccine before it's too late and hospitals in Northeast Indiana fill up.
Thinking back to kind of the beginning of the pandemic, Adams County had one of the first known cases of COVID, at least in our area of the state. So I wonder, do you remember the moment that you found out that there was a case in Adams County?
Well, I remember it distinctly because I found the case.
It was March 9th, 2020. Dr. Cameron Nelson, Director of Medical Affairs at Adams Memorial Hospital, was working the night shift when a patient came to the ER and set off his alarm bells.
I had actually been on a Department of Health phone call that was giving information about, hey, here's some markers that might identify how this would be this disease instead of this disease. And it was because of that phone call that I had this patient that I checked some other things that I normally wouldn't check and made the diagnosis.
In the year and a half since, Dr. Nelson has fought on the front lines of the pandemic, watching as his hospital filled with COVID-19 patients, overseeing an overhaul of his emergency department. His colleagues pushed to the breaking point. But then hope seemed on the horizon. There was a significant drop in COVID cases, a trend seen nationally.
We also weren't seeing a lot of flu patients. We weren't seeing a lot of patients with the common cold. People are hiding in their houses. So yes, we were absolutely seeing COVID cases, but not that many, and this summer, we were not seeing a lot of COVID cases. Unfortunately, that has really changed in the last couple of weeks.
And do you credit that to the Delta variant?
It's absolutely due to the Delta variant.
Now, Dr. Nelson is having tough conversations with his patients.
The approach that I've started to take is a very unfortunate one. I have started asking my patients that have come in with remorse and have said, I wish I had gotten the vaccine. And I just look at them and say, we are going to do everything we can to take care of you. All I would ask is go tell your friends to go get vaccinated now so they're not dealing with what you're dealing with right now.
As someone who admits to at first having a healthy skepticism of the vaccine, wanting to see proof it was safe and effective, Dr. Nelson got the shot as soon as it was available and can't help but point to the numbers.
Because I get a lot of resistance for, well, you can still get the virus if you get the vaccine. So what's the point? It doesn't help. Is the idea of and we've talked about that before, of a bulletproof vest. And you say, we're going to give you this bulletproof vest. And there's a 70% chance that if you wear this vest, that a bullet won't even hit you, won't even touch you. Say, well, that's a pretty good deal. But the better deal is that even if that bullet would hit you, say that you would get the virus, there's a 93 to 99% chance that you're not going to end up in the hospital, you're not going to have long-term complications, and you're not going to die. That it's pretty darn easy to put that vest on.
And for those who are still hesitant, his advice is to talk to someone you trust.
But just this idea that, we're the same people that you used to ask about your kids' earaches. We're the same people that you come get your broken bones taken care of. We're the same people that you come to when you're having a heart attack. We're the same people asking you to get a vaccine and put a mask on. So it shouldn't be that controversial.
And we should add, Adams County has one of the lowest vaccine rates in the state. Just last night, North Adams Community School Superintendent announced masks will be mandatory for students and staff in school buildings.